If your phone is just present somewhere, like it can be off, it can be turned around, notifications, but just having it there will absolutely reduce your attention and ability to focus, or reduce your attention span. And I feel like that's such a parallel to that fetal monitor.
Yeah.
Like you were saying, of you're in a room so aware, everyone's aware that there's this charting happening real time on your body, and that we're shifting our attention to that instead of shifting our attention to you. And just how much that little tweak can change the birth experience.
Yeah, changes the energy, right? Like the environment, the stress of me watching it, or somebody in the room watching it, or even a nurse coming in like, oh, you're having a big one. It's like, why did you say that?
Yeah, don't say anything. I know.
Just like you're saying with the phone, you naturally want to go and keep watching it because it's there and it's beeping and there's a lot of noise in the room.
Welcome to Birth from Within, where inner wisdom meets grounded preparation. We're here to share raw, real birth stories and offer the insight and tools you need to move through the system with courage, clarity, and authority. You were made for this. Your body knows what to do. This podcast is the heart work of a nurse and a perinatal chiropractor, women who have walked our own birth journeys, and now we walk beside you. In each episode, we share practical tools, grounded wisdom, and deep reverence for your body's design. Let's return to the root, because birth doesn't start in a delivery room. Birth starts from within.
Welcome back, Myra.
You said you're not going to say welcome back. Today we'll be talking about
what the New York Times just called the worst test in medicine. Is it justly named? What is the test? And let's talk about it.
Let's dive in.
A journalist named Sarah Cliff just wrote an article that was posted in the New York Times, which is a huge deal, it feels.
Yeah.
Looking at continuous fetal monitoring. So continuous fetal monitoring is something that I feel like is a baseline, synonymous with going into labor, but you might not know beforehand.
Mm-hmm. Yeah.
It is where you have two monitors around your belly that are very tight. One is monitoring the intensity of contractions, and the other is monitoring the baby's heart rate. And so they have to be in certain positions and are not very comfortable.
Not at all.
Yes, but it's
like their standard, right?
Yeah,
their standard of care. You're gonna get hooked to a fetal monitor no matter what. Even if you're low risk, high risk.
Yes, any risk. You had those.
Yes. Very uncomfortable.
How early on in your arrival to the hospital do you get hooked up?
Right away. Yeah, that's all part of, right? You take the vitals and then whoop, you hooked up.
You're in the belts.
Yep. And then there's a lot of pressure, right? Like you feel like your belly is being pressed on. Mm-hmm. If it's not reading the contractions of the heart rate, they're constantly moving them or making it even tighter, because like it has to be very close to the belly in order to get those.
You have to get the readings.
Yeah.
And so if they get situated, there will be alarms that beep. Mm-hmm. That's when your nurses come in, is when the alarm's beeping.
Yeah.
So it's looking at how nurses actually are going to be more often sitting outside. They're limited because they are required to chart those, I believe, every 15 minutes that they're charting the tones and those readings. And so how did this get started? It's fascinating to read that this was introduced in the 1970s, and it was completely experimental. There was not clinical studies, but it seemed very exciting because it took away the one-to-one care that was needed to go intermittently check baby's heart tones and check on a woman and watch her and observe. And now let women monitor 1, 2, up to, I believe they said 8 patients. I don't think nurses, that's not a ratio during birth, but that now people can just watch monitors. And so it seemed great. It was introduced in the 70s. Women didn't know it was experimental, and now it's become, like you said, standard of care. Some interesting stats here are that fetal monitoring was used among 45% of laboring women in 1980, 62% in 1988, 74% in 1992, 85% in 2002, and currently is about 90%.
Oh my God. So it's like
so high. The craziest thing with this is that there is no proof that it improves fetal outcomes. In fact, there's been many studies that compare it to intermittent monitoring and other ways to monitor women, and it's absolutely the same. So it's not beneficial. And are you ready? This technology has increased a woman's odds of cesarean delivery by 63%. And women are 15% more likely to experience the use of vacuums or forceps. That's wild.
The chiropractor in me goes, vacuum and forceps and C-section.
Yeah, yes. It's a lot of trauma. to be induced. And so what it's showing is that because it's monitoring the tone, the fetal heart tones, so the second highest cause of cesarean delivery is fetal distress, which they're looking at the monitor. However, what research has shown is that fetal tones are pretty unpredictable, and those D cells aren't necessarily saying that your baby's in distress. Yet, it will be the number one reason that people say, oh my gosh, we need to have an emergency C-section, your baby's not tolerating this, and they'll go to the ER. So a lot has changed since just 1970, like radical change. So Myra mentioned a few of the cons, and so I think that's just important to touch on, is that it's another reason that you're glued to a bed, and what's the worst possible thing you could be doing in labor? Just sitting on your back
just laying
in bed. It's terrible. So as you try to move, you'll often come back and be told to get back in bed. If you're going into a hospital where this is the standard of care, which is most facilities, you do want to talk with your care team early on and say, is it an option for me? Because we're not suggesting that there's no monitoring, although that is an option, but just that people can listen with a stethoscope or a ultrasound Doppler, which frees you to be in water, a shower, a tub. It frees you to move about, to roll, to sway.
Which when home birth, right? You don't see that a lot in home birth, because they have that. The fetal Doppler.
Yes, or
the other one.
So many other ways.
Yeah.
And women that are outside of the hospital system that work in birth, like midwives at a midwife center or home births, are trained to observe women. So there's a lot of ways you can know that you're progressing in labor. So for me with my babies, I had one cervical check with my first very late in labor. My second one, my midwife was not even there, so I had no cervical checks. And what do you know? Still had a baby.
Yes.
On my second baby, I had nobody checked the heart tones at any point, and it was all okay. And I was able to move freely, to listen to my body. There's just no constraints. And my first baby, I was in a birth tub, and I know just intermittently they would just get the Doppler that was waterproof and check. So when they compare the two, when you're intermittently monitoring, right, you're not catching as many D cells, yet catching the D cells isn't improving baby outcomes.
Yes. Right, like if we're bringing birth to be more like a intuition stuff, more like trust your body. I personally, I had to hospital birth, so I was monitored, and then the stress that I would feel, first because it was very uncomfortable, second to hear the nurse stop moving, or like I'm messing up their monitoring. Also, I remember how I would see the screen, because you could see the screen how contractions will come and then go down, and you're usually seeing the spike before I can feel the contraction. Oh. So every time I would see like, oh my god, it's coming. So my body would go, yes, instead of, not knowing when that would happen, and
so it actually brought you stress.
Yeah.
And you can imagine too, if you know what you're looking at with the baby, that can feel stressful. So you're just bringing in a lot of anxiety.
Yeah. Not only me, but anybody that will be in the room. Like I remember say, oh, there's another contractions. And I was like, oh, so like.
You've shared your birth stories, which you can listen to in previous episodes.
Yeah.
But one of my favorite anecdotes is that your husband was in there freaking out, like so much fluid's coming out of her, like the baby's coming. And he runs out in the hallway to the nurse station. He's like, somebody needs to come in here, the baby's coming. And they're watching monitors and they're like,
she's fine,
chill out. Your doctor went home.
She went to sleep, yeah.
How long after that point? Like
I would say like 30 minutes.
30 minutes.
Because they have to call her and say, no, come back. And even when she was there, it's like, oh, don't push. So, it was that close that my husband could identify, oh my God, there's a change. And your husband's
not trained in
no, at all.
We could tell. That's crazy.
Which that is, again, intuition, right? Like you could see somebody, how it goes from transition. You don't need something artificial to tell you, okay, the contraction is coming, or the heart is like that. And if you get stressed, baby is probably gonna be stressed. Yeah. But again, is that really a reason why, let's go to C-section? Now that you know this information, how can you also coach yourself to relax if that would be the case?
Yeah.
That's another thing of when we talk about doulas, how important is having them. They could reassure you, like breathe and affirmation and all this stuff to calm down the stress.
Yeah. Which is the goal.
Yeah.
I just want to add that my doula was with me at my second birth, and she walked in, and it was a fast labor. And I remember just thinking, okay, it's getting so intense. And in my head, I was like, okay, she hadn't been with me at my first birth. So I'm like, I'm wondering what she's thinking of me. Is she like, oh, she's struggling. Like, we got a ways to go. So I remember asking her later, like, were you concerned about like my ability to have this baby at home? She's like, nope, I just thought, we're having a baby soon. But again, she'd been to so many births, and I thought that was a great answer when I actually didn't know. She did.
And that also shows, right, like that disconnection. These nurses couldn't identify the baby's coming, while doulas can tell, like we're getting close.
Or your midwife later. So again, they're observing how close together your contractions are, how you sound, where you're going. They're just watching. You can feel baby's position just by manual feeling.
Well, it's a Leopold maneuver that you can
to tell their descent.
Yeah.
So there's lots of ways to still be monitoring and assuring that the baby is okay without having to be hooked up.
So the question will be, right, like why has it been a race in using continuous fetal monitor if the science is not even backing up that is improving anything?
Yes. Great question. There's 2 countries that have actually now cautioned against the use. Canada and Britain have changed their guidelines, but in the US, the ACOG, which dominates that, has still said, we still support it, and many OBs will back it as well. And you have to look at, if we adopted this in 1970, pretty much any provider you're going to see in a hospital where it's standard of care has only worked in births with continuous fetal monitoring. So one, it's just the change. Change is slow to be adopted. And not just change, they haven't been trained to assess manually, to watch, to do a Doppler, to do a stethoscope, and so that requires additional training.
Well, and it's probably gonna take more time, right, to the doctor that is watching, like, I don't know how many people at the same time.
Yeah, so you can't just go pop in the monitor, like, where are we at? Same with the nurses, that now it would require a lot more hands-on. And it's not saying that they don't care, because there's so many nurses that are so amazing, but there are so many constraints on their time for what they're required to do. And then that precedes, probably the primary reason is litigation, that these heart tone readings are used for litigation. And that's where, when you walk into a hospital, everything is set up around don't get sued. And so it's a lot easier to quickly take you to a C-section because there was a sign of fetal distress than to realize, oh, baby's okay, we just wait a little bit, baby's recovering fine, or this reading's not telling us anything. But we're relying on that and then using it so detached from that woman in labor. We love to point to a cause. Basically, there's not much that supports it, but it's a very hard thing to, one, say we're wrong, and two, to pivot. And so as women, you have to find that in so many ways you have to be your own biggest advocate, along with your husband or your doula when you walk in. And a lot of this is pre-planning. That education can be empowerment. And so, is anybody here trained to do this? Can I see that care provider? Can I opt for not always wearing those bands because they're annoying and they're interfering with my mental state, which is one of the main tools you have in your birth is your mental state, and the confidence to not be stressed of like another one's coming, instead to just be able to relax between the contractions, not watching a monitor, but present in your body.
Yeah. And other thing I would say, follow the money, right? It's still a business, it's still better profits for the more.
Oh yeah, they're very expensive machines. But for low risk women is the standard. But for any woman, that, again, it's not really improving. It's not improving outcomes, and is instead causing potentially a lot of harm and a lot of unnecessary stress and a lot of unnecessary surgeries. Or
the use of tools that is just gonna start that baby not that great.
Yeah, and that there's trauma you have to navigate through with the urgency and stress they're bringing to your birth, instead of just letting birth unfold and letting you listen to your body. I read a book recently called The Anxious Generation. It's looking a lot like social media, technology in our lives. But with friends, we were talking about how much, if your phone is just present somewhere, like it can be off, it can be turned around, notifications, but just having it there will absolutely reduce your attention and ability to focus, or reduce your attention span. And I feel like that's such a parallel to that fetal monitor.
Yeah.
Like you were saying, of you're in a room so aware, everyone's aware that there's this charting happening real time on your body, and that we're shifting our attention to that instead of shifting our attention to you, and just how much that little tweak can change the birth experience.
Yeah, changes the energy, right? Like the environment, the stress of me, right? Of me watching it, or somebody in the room watching it, or even a nurse coming in like, oh, you're having a big one. It's like, why did you say that?
Yeah, don't say anything. I know.
Just like you're saying with the phone, you naturally want to go and keep watching it because it's there and it's beeping and there's a lot of noise in the room.
And I just remember during contractions, there was a time I was leaning over, my husband was putting ice packs on my neck, but it kept falling off and it was jolting me out of it, and it was making me so, I'm like, dude, babe, my love, like, you cannot let that fall. Like, you have to hold it right there, because that little bit gets you out of it and it changes how you're able to cope with that contraction. So I just can't even imagine those beeps and interruptions and the people coming in and fixing a band while you're in an intense contraction.
And it has clips, so like if this clip didn't work, then let's go higher, like tighter, the next one.
Which I just go back to commending women so much, because I think so often it's like, I'm just gonna go to a hospital first just to be safe in case anything goes wrong. Like the things that you have to go through, where I just didn't have to deal with, I just never had to have that, and I'm grateful. But that
had your
how much easier for me, right? Like,
that's not what most people realize. How
there's another way.
You don't need. There's another way, and you might not need. If you're low risk, pregnancy has been beautiful, then why do you need to submit to all of these things that are not even improving the outcome of birth?
Yes.
It is standard of care in the hospital. You might want to ask questions if you can have, maybe not the whole time, but intermittent. Just know that if you're choosing hospital, that's one of the first interventions that they're gonna not even ask you if you want to. They're coming in to put it.
And that you have to know to choose your battles and who you're up against, because some people will give a lot of pushback, and then you're going to start with the resistance of like negligence, right? Because that's what the providers are worried about, of looking negligent. And so it's saying like, okay, now you have to sign your life away. Everything's your fault. And that also mental burden when you're there for help it's going to be an easy way to be swayed into it, when you're like, okay, well, I've literally just increased my risk of being transferred to the operating room. Does that matter to you? And
right, that's the question. Know that it's there, how much it matters to you. And if you're like, I have no choice, I'm going there, then what could be a coaching, right? Like, what could be your mental state into going into those things? Because the first thing, right, they're vitals, then you have your IV, and then continuous monitor. So you're already saying no IV, just put like the port, vitals, because the vitals is other thing that is so annoying. Like
a lot of times they'll just leave a blood pressure cuff.
Yes,
and you're just sitting there going in and out and in and out, squeezing.
Because I do do birth at hospital. Go to adjust people in the hospital, and I had this one time, this lady that had the blood pressure cuff so tight, and she would scream like, this is hurting, and nobody would come. It's like, oh my god, like, what is
until she takes it off, and then they're like, oh no, don't take that off. Don't take it off. But again, it's a machine, not a person coming in to manually check your blood pressure. It's a machine that they're taking a reading off of,
that if it can't find it, it'll go tighter and tighter and tighter
and beep, and it's a lot. You brought up a great point that maybe to help detract from that distraction and noise is headphones. Like if you're going to be in that, letting people know like, I need to move. I'm going to be on a ball, so it might be messing up. Please, if I'm in a contraction, do not bother me. And that's where you have advocates and people, like if they come in because something's beeping and they want to fix your monitors, it's like, do not let them touch you when you're having a contraction. You can have people to say, hey, let her finish this. And if you could be in your own spot, headphones could be a huge tool to help mitigate the distracting noises that could really throw you.
Yeah. So that's a good idea to tell, if you're hiring a doula, right? To tell the doula, please, like, remember this too, that if something is happening, leave me alone, and then we can fix, change, or whatever.
And reassess from there.
Yes.
And just be ready to be annoying. It's okay. You should be.
And know that, right, if you're choosing a home birth, this is not the case. The case. Oh my gosh, this is not the case.
Yeah, it just doesn't exist. So points for home. And most birth centers, they would not. I can't imagine that that's a routine thing. No. Points for midwives, I guess, who have been more trained in different techniques to monitor you and keep you safe. Because, that's in the end what everybody wants. And our hearts is just that fear is so often used as the motivator to do things that you don't want to do in the light of, oh, thank God, oh, they saved my baby. But when you're looking at the amount of C-sections that are performed unnecessarily, there is cause to pause and just say, how can everybody be more for you so that you can have the birth and the best outcomes for you and your baby also, without fear as the driving force making you do things against your will. Because of course, when you hear, you have to do this, your baby's in distress, what choice do you have as the mom? And so you then you have to lay down everything you want, seemingly, as we're talking, that we're finding more and more, like unnecessarily.
Yes.
And that's not fair.
If you go the best education, right, like maybe your chances of saying, oh man, I could have done different, this won't be your case, because now you're getting educated, you know the facts, you know the science and what the research is saying about this. And then again, ultimately you can make the best choice for you and your family.
The information provided in this podcast is not medical advice. It is anecdotal and for general knowledge and informational purposes only. It is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have. The use of this information is at your own risk.